coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome to the Evaluation and Management Group Study Week 4. How are you all doing? Yes, it's week 4, and this is the final week for our group study for evaluation and management. So, coders, let me know how are you feeling? Uh, did the evaluation and management study session help you in increase your confidence coding those E&M scenarios, leveling and scoring the MDMs? Please let us know where you stand from where the classes started during the week 1 and how are you feeling now? Just let us know in the chat. So let's begin the week for the final week of evaluation and management study group by introducing the interns. As I always say, they are the backbone of Tuesday study group. Let us welcome Miss Tanya, Miss Karen, and Miss Stephanie. So they are in the chat. They are the one who are helping you out and encouraging you all. We have Miss J, AMCI Curriculum Director, and that's me, your instructor, Mr. Sandeep, from joining you from UAE. So let's begin. What keywords to highlight for E&M documentation? So we have to highlight the age of the patient, the diagnosis, signs and symptom, the exam, the procedure, anything which the doctor does, total time, medical decision making data reviewed. How to select the E&M code, answer or do the following, whether there is a medically appropriate history or exam performed, location of the visit, whether it's an inpatient visit, emergency department visit, office consultation, office visits, type of the visit, is it a new patient or an established patient, total time of the visit, medical decision making, E&M tables to select the codes, finally apply all the guidelines. Now let's move on and let's see how to select an E&M code based upon time. So when there is a time documentation, we have to follow these steps. So they are similar, but we have to skip one particular step. We have to check whether there's a medically appropriate history or exam. We have to check for the location of the visit. We have to go and check the type of the visit, whether it's a new or established. Then we move on to the step 4, total time of the visit. We will skip the step 5, that is for MDM. Then we have E&M tables to select the code. Finally, apply all the guidelines. Now, how to select an E&M code when the time is not documented? Again, steps remain the same. Instead of step 5, this time we will skip step 4. We have to check the history and exam, whether a medically appropriate history or exam has been performed. We have to check for the location of the visit, the type of the visit, whether it's a new patient or an established patient. Then, as I said, there won't be a time documentation. So we will move on to MDM, inventory, and then score. Fine. Then we move to step 6, where E&M tables are used to select the codes. Finally, step 7, where we apply all the guidelines. Review and score the documentation for MDM. Yes, so then since we know that MDMs are evaluated and scored based upon these 3 categories, I will be referring them to these category C items as a PDR. So P stands for number of problems and complexity of presented problems. D stands for data, the amount, complexity of data is being reviewed. And R stands for the risk, which is overall patient risk. And that is a PDR chart. And this is a brand new PDR chart with a lot of update from the previous one. We have added office consultation codes. We have added the nursing, the home care codes. So all those codes has been added to the PDR chart. And where can I get them? They are available in the MCG manual. So let's see what we reviewed in the previous classes. We reviewed about the home visits, medical team conferences, preventive medicine, medical care plan oversight. We solve certain scenarios on based on them. We also reviewed the neonatal intensive care chapter. We reviewed the care management codes, transitional care codes, standby services, and last week we did some E&M scenarios based on what we have studied so far. This week also we will continue and do furthermore scenarios based on E&M and MDM scoring so that you will get more and more practice doing them. Okay, so let me have a look into the chat and see how you all are doing. Yes, this is going to be the final week of our E&M study groups. So this is week 4. We already completed the first 3 weeks. Yes, so I can see people saying, yes, students have been saying the group study has helped them a lot. Yes, so let's do some more practice scenario so that you will feel more confidence in solving these E&M cases. So are you ready, coders, for practice sessions? Okay, so let's begin. So this is the first scenario for day, and I would like to invite Ms. Stephanie to read this scenario.
Hello, hello, coders. So glad that you all made it. Based on the above information, please select the appropriate CPT code for this visit: A 99213, B 99202, C 99203, and D 99214. A 55-year-old male patient presents to the office with chest discomfort that has been intermittent for the past 2 weeks. He describes the discomfort as squeezing sensation that sometimes radiates to his arm. It typically lasts for a few minutes and is usually provoked by physical exertion. He has a past medical history of type 2 diabetes, which are managed with medication. He is a current smoker with a 20-pack year history. Family history reveals his family had a myocardial infarction at age 60. The, the physical exam is unremarkable, with normal vital signs, clear lungs, and a regular heart rhythm with no murmurs. Given the patient's symptoms and risk factors, the physician decides to order a series of tests, including troponin, EKG, and a stress test. Test resulted Test results are reviewed and diagnosed patient with chest pain due to muscle spasm. The patient is advised to refrain from strenuous activity and take rest for a week, and follow-up appointment is scheduled. Based on the above information, please select the appropriate CPT code for this visit, and your time begins now, and I know that you can.
And that is time. Let me quickly look into the chat and see how you all are doing. I see that you all are doing a phenomenal work. Yes, so let's go ahead and let's solve this scenario. We have a 55-year-old male, chest discomfort, is current smoker, family history of myocardial infarction, physical exam performed, order a series of tests including troponin, EKG, stress test. The test results are reviewed. Chest pain due to muscle spasm, and doctor has asked him to take rest for a week and refrain from strenuous activity as well. So coders, let's ask the questions that will drive us to the answer, correct answer. Is there a medically appropriate history or exam performed? Yes, there was a medically appropriate history and exam performed in the scenario. What is the location of the visit? This is a office visit. Am I correct? Yes, this is an office visit. How about the type of the patient? Is it a new patient or an established patient? Let me know in the chat coders. Yes, this is going to be an established patient. Why? Because it was nowhere mentioned in the documentation that it is a new patient. So unless it's documented as a new patient, we won't consider them as a new patient. So we'll take it as an established patient. And is there any total time documented for this visit? No, total time is not documented for this visit. So what are we going to do next? We are going to do the inventory of MTM and then score. So since it's an established patient, we could have eliminate option B and C directly because those codes are for new patient codes. 99202 and 99203 are for new patient codes. So they are wrong on site. It's between 213 option A and option D, 99213 and 99214. To know which is the correct answer, let's do the inventory. So we have a diagnosis signs and symptoms. We are having a chest pain that is due to muscle spasm. We are having a diabetes mellitus. And in the procedures, what did the provider do or is going to do, did or going to do? We had a troponin test, EKG test performed. We have a stress test as well, and those test results were reviewed as well. So would you consider diabetes mellitus in the problem addressed? No, because the condition was not addressed in this scenario. That was not treated here. Treatment and all the workup was for the chest pain. So where do you take the chest pain in the problem column, coders? Where did you where does the chest pain due to muscle spasm fall? I would take it as an acute, uncomplicated illness or an injury. That would be a low problem. Yes, that would be a low problem. And how about the data? What will be our data coders? Come on, place your answers in the chat coders. So let's make this one an interactive session. So how about the data? So we have a 3 test, unique test, which has been ordered and reviewed. So I think that will only fall in low data level. Yes, only category 1 has been satisfied. That's a low data. And how about the risk? Yes, that is a low risk. So our ENM level would be exactly, it would be 99213, and that would eliminate option D. So we'll throw out the lowest level, select the next highest level. So between option A and option D, the correct answer would be option A. So, how are you feeling after the first scenario, coders? Let me know in the chat. So, is that clear? Are we good to go to the move on to the next scenario? There you go. Yes. So let's move on to the next one. Once again, I would invite Miss Stephanie to read the scenario number 2 for us.
Olivia, a 32-year-old graphic artist, experienced sudden pain and redness in her eye. Over the next day, her vision became blurry and she noticed floaters. Miss Olivia visits the ophthalmology department of nearest hospital for the first time to get her eyes examined. Dr. Andrea, senior ophthalmologist, takes Miss Olivia's medical history and examines her eye, revealing inflammation inside the eye and diagnose her with uveitis and prescribes antibiotic drops for 1 week. What is the EMM code is report for the ophthalmologist visit? Your time begins now.
And yes, coders, you all are getting their great work. Excellent work, coders. So thank you, Miss Stephanie, for reading the first two scenario for us. And let's solve this one, coders, together. This was a challenge scenario. You didn't had any option to select this from, select a one from. So let's highlight the keywords. Patient had a pain and redness in her eyes. She noticed floaters. First time to get her eyes examined in the hospital. Dr. Andrea, senior ophthalmologist, performs a medical history and examines her eyes and diagnoses the patient with as a uveitis and prescribes antibiotic drops as well. So let's start by asking our questions to solve the scenario. Whether there's a medically appropriate history or exam performed. Yes is the answer. There was a medically appropriate history and exam performed in the scenario. How about the location of the visit? Is it yes, it's an office visit, right? Yes, it's a hospital office visit. It's in a, yes, exactly. It's an ophthalmology department. It's an office visit. It's not an inpatient visit. It's an office visit. And with that, let's move on to the third question. Is it a new patient or an established patient? Yes, this is a new patient because it's been mentioned over in the document that the patient visits ophthalmology department in the nearest hospital for the first time. So that means the patient is a new patient. So total time documented? No, there was no total time documentation in our scenario. We are moving on to the step 5, which is medical decision making. We are going to inventory and score. So what do we have in our inventory? Diagnosis, we are having uveitis. Procedure, it's just an antibiotic prescription which has been given to the patient along with an examination performed. So let's move on and let's start leveling. So how about the problem? Where does this condition uveitis fall in problem column, coders? Come on, Goddess, let me know in the chat. I want full participation in this scenario. Yes. Exactly. It falls in a low column. Yes, it's a low problem with an acute uncomplicated illness or injury. Exactly. How about the data? Did we had some data reviewed in the scenario? Was there any data reviewed? No, there was no data reviewed in the scenario. So that would be a straightforward minimal or no data exactly. And risk, what's the risk here? Yes, an antibiotic drop was prescribed, and that would be a prescription management and a moderate risk. So are you getting that? How I picked a moderate risk? This is a prescription management and antibiotic drops was prescribed. Yes, that would be a moderate level risk. And then we will throw out the lowest level out, and then we would take the next highest level. That would be a 99203. Oops, that would be a 99203. Exactly. Wouldn't be the exam data? No, exams are not included as a data reviewed. They are different. That's why we asked them in the first place. Was there a medically appropriate history or exam performed? Because it is a important point which we have to look into. So are we good with the scenario coders? The correct answer is going to be 99203. Did the explanation help? Shall I move on to the next scenario? Yes, you all are doing a good job. Yes, you all are taking the challenge and doing pretty well. Yes. So let's move on to the scenario number three. And this time it's Miss Dania who is going to come and read the third scenario for us.
Thank you, Mr. Sandeep. I'm reading the options first. Option A 99213, option B 99213 99358, option C 99358 99359, option D 99358 or 99359 two times. Dr. Samuel conducts review of medical records of his patients, Mr. Sam today, who has seen him yesterday for the follow-up examination. Dr. Samuel spends 1 hour 40 minutes reviewing patient's record, making notes and documenting patient's treatment plan. Because of worsening of diabetes and H1 HB1AC, result turned out to be higher side. Doctor will follow up patients tomorrow to discuss the regarding lab, C and treatment plan. What E&M code reported for Dr. Samuel's service? You have 2 minutes for this challenge.
And that is time coder. So anyone to place your answers in the chat? I will give you 5 more seconds. And yes, so let's start by solving the scenario by highlighting the keywords. We have Dr. Samuel, who performed a review of medical records of his patient seen by him yesterday. Dr. Samuel spends 1 hour 40 minutes reviewing patient's medical record, making notes and documenting. And because of worsening diabetes mellitus, as his HbA1c turns out to be on a higher side. So what are we coding for? We are coding for the ENM. We are doing an ENM code for Dr. Samuel's services. So is this a prolonged visit, coders? Yes, this is a prolonged visit. And what type of prolonged visit are we looking at here at? Exactly. Exactly. See, you guys are professional ENM coders by this time now. We are coding for a non face to face doctor visit on the day other than the ENM. Exactly, correctly said, coders. And we have a guideline for this, the prolonged services on the date other than face to face evaluation and management without direct patient contact. It states that the codes 99358 and 99359 are used when prolonged services are provided on a date other than date of face-to-face evaluation and management encounter with the patient and or family or caregiver. So we had an encounter. It's not with direct patient contact. It's without direct patient contact, and it's on a date other than ENM visit. So let's look into the codes. Let's look into the CPT codes which we have here. So we are going to code for 99358 and 99359. So 99358 is for prolonged evaluation and management before and after direct patient care for the first hour, and 99359 is for each additional 30 minutes in addition to the code for prolonged services. And we also have a guideline which states that do not code 99358 and 359 on the same date of service as 99202, 99203, 204, 99205, 99212, 99213, and it goes on. So that means we can't append these codes. Yes, 99358 or 99359 on the same date of service for the for options A for ENM codes for the office visit codes. So option A and option B will be incorrect. We can eliminate them, and the remaining two options are option C and D. So how much time do we have? We had a Dr. Samuel who spent it 1 hour 40 minutes in reviewing patients' medical records and making notes and documenting them. So where does 1 hour 40 minutes falls in our prolonged visit table? I see that's fall in, yes, that falls between 75 to 104 minutes, between 115 minutes to 144 minutes. That would be 99358 and 99359 times 1. So we are not going to code for an additional 50 minutes. That will eliminate option D, and the correct answer is option C, 99358 and 99359. So how are you feeling about that scenario, coders? Did the explanation help? Yes, so good work on that one, that scenario. So shall we move on to the scenario number 4? Are you ready for scenario 4? Yes. Okay. So once again, I would invite Ms. Zenia to come on the stage and read the scenario 4 for us.
Hello, coders. Sarah Johnson, 60-year-old, admitted to hospital due to severe pneumonia with complication. Dr. Smith, a pulmonologist, provided initial evaluation and management service. The visit included comprehensive history, detailed examination. Dr. Smith reviewed chest X-ray which showed pulmonary consolidation without volumeless suspecting maybe lobar pneumonia. A series of blood tests were run. CRP was elevated at 70 mg per dl. Dr. Smith spent 1 hour 35 minutes evaluating Sarah and reviewing records and prescribing antibiotics. What E&M code is reported for Dr. Smith's service? You have 2 minutes for this question.
So, how are you all doing, coders? Let me quickly look into the chat. Great, great. I've seen great things in the chat. Phenomenal work, coders. So thank you, Miss Dhanya, for reading scenario 4 for us, scenario 4 and scenario 3 for us. So I will go and explain this scenario for you all. So this was a little bit challenging scenario. There was no option once again for you all to solve. So we have Miss Sarah Johnson, 16-year-old, admitted to the hospital with case of severe pneumonia with complication. Dr. Smith, a pulmonologist, provided initial evaluation and management. He performed a comprehensive history, detailed exam, and Dr. Smith spent 1 hour 35 minutes evaluating Sarah and reviewing the records and prescribing antibiotics. So, what are we looking here at? We are coding for Dr. Smith's evaluation and management services, and doctor spent a total of 1 hour and 35 minutes evaluating patient. The patient was admitted to the hospital. That is also very important point to note in this scenario. And let's start by answering the question: was there a medically appropriate history or exam performed? Yes, that's the answer. Location of the visit: this is an hospital inpatient visit because we can see it's documented the patient Sarah Johnson, 16-year-old, admitted to the hospital, and this is an initial evaluation as well because you that's also documented. Dr. Smith, a pulmonologist, provided initial evaluation and management service to the patient. Next question. Yes, is that a new or established patient? So we have said it's an initial evaluation performed. Is there a total time documented? Yes, a total of 95 minutes has been documented in our case here. So coders, is this a prolonged visit? And yes is the answer I see in the chat. Yes, this is a prolonged visit. And what type of prolonged visit is this, coders? Question number 2, what type of prolonged visit is this? Exactly. This is a prolonged visit with or without direct patient contact on the date of evaluation and management. Yes, this is an inpatient prolonged visit. And let's look into the CPT codes. Let's look at 99223 and 99418. 99223, when using total time on the date of encounter for code selection, 75 minutes must be met or exceeded. Yes, that's criteria is satisfied here. We are having a total of 95 minutes. And to code 99418, prolonged inpatient code. Yes, prolonged inpatient or observation evaluation and management service time with or without direct patient contact beyond required time of the primary service when primary service level has been selected, using total time. Each 15 minutes of total time must be met. So coders, so after 75 minutes, how long did the doctor evaluate the patient? To know that we can subtract the total time, that is 95, from the total time required to bill 99223. That would be 75, and that would give us a 20 additional minutes spent. So will that 20 minutes satisfy to bill 99418? And yes is the answer which I am getting. So how many units of 99418 can I bill in the scenario? Question number 2. You have 20 minutes of additional time here. Yes, just one quantity of 99418 can we build in the scenario, because do not report, we have a parenthesis and the guideline here which says that do not report 99418 for any time unit less than 15 minutes. Exactly. There you go. We have a forensic coder here saying it can only be built if we have to, if it satisfies 15 minutes. Exactly. So the code for this scenario, prolonged visit inpatient scenario, is going to be 99223 and 99418. So let me know in the chat, coders, how are you doing on this one? Are you following? Did the instruction help? If you need further assistance, let us know in the chat. Okay, so it seems like all are doing good with the scenario and explanation helps. So if you need any assistance on this case or any cases we discuss, please let us know. So let me move on to the next scenario. And I think it's Miss Stephanie coming back to read the scenario number 5 for us.
Yes. What E&M codes are reported for Dr. Smith's services? A 99442, B 99283 and 99442, C 99283, D 99284. John Davis, an established patient, 64-year-old male, reached out to Dr. Smith, his primary care physician, by phone to discuss his recent symptoms of shortness and cough since 1 week. Dr. Smith spent a 20 minutes on the phone with Mr. John, discussing his current health status, reviewing current medications. After reviewing clinical symptoms, Dr. Smith suspects pneumonia and he decides to see Mr. John in hospital immediately. Dr. Smith see Mr. John in emergency department within an hour, performs medically appropriate history and examination. Chest x-ray was ordered and reviewed. Dr. Smith diagnosed patient as acute bronchitis and prescribed steroid nebulizer. What E&M code is reported for Dr. Smith services? Your time begins now.
And that is time. Okay. Okay, goddess. So let me explain this scenario for you all. Thank you, Miss Stephanie, for reading scenario number 5 for us. And let's start by highlighting the keyword. John Davis, an established patient, reached out to Dr. Smith, his primary care physician, by phone to discuss his recent symptoms of shortness of breath and cough, and spent a 20 minutes on the phone discussing his current health status. He decided to see Mr. John in hospital immediately, and Dr. Smith sees Mr. John in emergency department within an hour, and he performs a history and examination. Chest x-ray was ordered and reviewed. Dr. Smith diagnosed the patient as an acute bronchitis and prescribes steroid nebulization. So what E&M service is reported for Dr. Smith's services? So we are looking into the E&M codes for Dr. Smith. We had a 20 minutes conversation on phone with Dr. Smith, I'm sorry, Mr. John by Dr. Smith. And Dr. Smith also sees the patient, Mr. John, in emergency department within an hour after the telephone conversation. So we have a guideline to build telephone conversation over here. It says that if a telephone service ends with a decision to see the patient within 24 hours or next available urgent visit appointment, the code is not reported. Rather the encounter is considered as a pre-service work for subsequent evaluation and management service procedure and visit. So coders, my question, did Dr. Smith saw the patient after telephone conversation or telephone service? Yes, and that too happened within an hour. So, as per the guideline, if a telephone conversation ends with a decision to see the patient, can we bill telephone services? No. No, because that is considered as a pre-service work for the subsequent E&M service. So the patient saw Dr. Smith saw the patient in emergency department, and we are going to bill for an emergency department service being provided. So option A and option B straight away is wrong. Option A is coding for a telephone evaluation and management services provided by a physician, 11 to 20 minutes of medical discussion. That's incorrect. That's wrong. And option B is also incorrect. That is also having a 99442, which is a telephone service E&M code. That leaves us with option C and option D. So it's between 99283 and 99284. So what are we going to do? We are going to inventory and do leveling of our MDM. So we have acute bronchitis. In diagnosis and procedure, we had a chest x-ray performed and the steroid nebulization prescribed by the doctor. So acute bronchitis, I would take it under low problem, under acute uncomplicated illness or injury. So how about the data coders? The question is for you all. What is the data in this scenario? Yes, that is a low data. We had only a chest x-ray which is ordered and reviewed. That would be a low data. And how about the risk? How about the risk? There you go. There you go. Yes, nebulization, steroid nebulization was prescribed, and that's a prescription management. That would be moderate risk. Yes, moderate level risk. And we have a low level E&M for emergency department visit. That would be 99283. Exactly. There was a prescription ordered, and that would be a moderate level risk. And the E&M level would be a low level ENM, and that would be 99283 for emergency department visit. That would eliminate option D, and the correct answer is going to be option C, 99283. So was that an aha moment, coders? And how are you feeling about that scenario? Are we good? Yes, someone mentioned guidelines are the key in the scenario. Yes, exactly. This was a scenario which is in which we had to look at the guideline as well. What page is a telephone service guideline? Sorry, someone, a team, can you please look into the guideline, in which page the guideline is, and help our student? So I think it's under telephone guideline service ENM section. So let's move on to the next scenario. Yes, there you go. The students are helping us. It's in page number 35 in your 2023 CPT book. Thank you, team. Thank you, coders. Excellent. So let's move on to the scenario number 6. And this time it's Miss Dania who's going to come and read the scenario for us.
Hello coders, your options are A 99366, B 99367, C 99368, D 99308. A 50-year-old patient, Miss Davis, is receiving treatment for stage 3 breast cancer. Dr. Thompson, nurse in charge, organizes a 45 medical team conference with the radiologist, surgeon, and oncologist to discuss Miss Davis' progress, review her imaging studies, and develop comprehensive treatment plan includes surgery, chemotherapy, and radiation therapy. The patient not present at the conference. The CPT code should be used for Mr. Romson's participation in the medical team conference. Your time starts now.
Okay, coders, I think that's more than 3 minutes. And yes, I wanted you all to get some extra time to look at this scenario forensically. So let's solve this one. We have a 55-year-old patient receiving treatment for stage 3 breast cancer. Mr. Romson, nurse in charge, organizes a 45 minutes medical team conference with a radiologist, surgeon, and oncologist to discuss Ms. Davis' progress. The patient is not present at the conference. What CPT code should be used for Mr. Romson's participation in medical team conferences? And these are our code options. We are coding for Mr. Romson, who is nurse in charge, participation in medical team conference, and there was a 45-minute medical team conference with a radiologist, surgeon, and oncologist as well. So I can eliminate option A, 99366, because it's coding for a medical team conference which involved a face-to-face discussion with the patient. Well, in our scenario, it was documented that the patient was not present at the conference. So 99366 involves a face-to-face interaction with the patient as well, involvement of a patient as well. So with that said, option A is incorrect. Yes. Yes, I can see, once again, I can see a few aha moments in the chat coming up. And okay, let's move on with the scenario. So also I can eliminate option D, that is coding for 99308, which is a subsequent nursing facility care per day. We are not coding here for a nursing facility care. We are coding for Mr. Romson's participation in medical team conference. So that's why we always insist to look into the last portion of the question. Yes, we have to look whom are we coding for, what are we coding for. That's why I always say read the last portion of the question and then read the options available, then read the scenario. So you will have a better understanding of what we are looking at. And option D is also incorrect. So remaining is option B and option C. So I can eliminate option B, 99367, because it's coding for a medical team conference which involved the participation of a physician. This is for a physician's participation which we are coding. Well, in our scenario, we are coding for a participation by a non-physician, which is a nurse in charge, Mr. Romson's participation in medical team conference. Yes, aha moment. So option B is also incorrect. That leaves us with option C, which is 99368, that is for a medical team conference with interdisciplinary team of healthcare professional, patient, and or family not present 30 minutes or more. We had a 45 minutes of medical team conference, participation by non-physician qualified healthcare professional, which is for a nurse in our scenario, nurse in charge for a scenario. So that eliminate option A, B, and D, and we have a correct answer in option C. So how was that one? How was that scenario, coders? Did the explanation help for this one? Yes. Yes, someone didn't see what the question was for. Exactly. Okay, so yes, be a little bit forensic while you read the next scenario. Okay, then now let's move on. Shall we move on to the next scenario, coders? Yes, everyone is ready to move to the next scenario, and we are having scenario number 7. Yes, so of the following, which best describe Dr. Smith's E&M encounter? Option A, 99254, option B, 99244, option C, 99222, option D, 99232. A 36-year-old patient, Mr. John Doe, admitted to the hospital by Dr. Xavier with the diagnosis of acute appendicitis. Mr. John was treated empirically with antibiotics. Dr. Smith, a senior endocrinologist, was requested by Dr. Xavier to evaluate patient for elevated blood glucose sugar level in the background of patient's diabetes mellitus. Dr. Smith reviews the patient's medical history and HbA1c report, conducts a thorough physical examination, orders a random blood sugar test. Dr. Smith sends correspondence to Dr. Xavier that the patient has worsening of diabetes mellitus with hyperglycemia. Insulin was added to Mr. John's medication chart of the following, which best describe Dr. Smith's E&M encounter. And chorus, you got 3 minutes to solve the scenario. I'm sure you're going to crack this one. All the best. And that's time. Second, you all are doing a phenomenal work here. Yes. So, solving this scenario, let's highlight the keywords. Before that, let me thank Ms. Dania for reading last scenario, scenario 6 for us. So, moving on with the scenario 7, we have a 36-year-old patient admitted to the hospital by Dr. Xavier. So, patient is admitted to the hospital. Important thing to note, acute appendicitis. Dr. Smith, a senior endocrinologist, was requested by Dr. Xavier to evaluate patients' elevated blood sugar levels. Dr. Smith evaluates, reviews patient's medical history and HbA1c report as well, orders a random blood sugar test, send correspondence to Dr. Xavier. Patient is having a worsening of diabetes mellitus with hyperglycemia. Insulin was also added to the patient's prescription medication chart. So asking the question, is there a medically appropriate history or exam? Yes. And we are coding for Dr. Smith's AENM encounter in the scenario. So location of the visit. Now this is an inpatient consultation visit. We have three are satisfied in the scenario. There was a request, there was a recommendation or service was rendered, and there was a report as well sent out to Dr. Xavier. Correspondence was sent to the Dr. Xavier, and patient was diagnosed with a worsening of diabetes mellitus with a hyperglycemia, and insulin medication was also added to the prescription. Yes, was also added to the patient's medication chart. So that means this is an inpatient consultation visit. Type of the visit, yes. Type of the visit, well, we don't have a code for a subsequent consultation visit. So this is all the consultation visits are initial consultation visit only. So let's start eliminating the wrong answer with the informations which we have. So option D is incorrect. It is coding for 9932. I'm sorry, 99232, which is a subsequent hospital inpatient or observation care. So this is a subsequent hospital inpatient visit code. We are coding for an inpatient consultation. So option D is incorrect. Let's look into the next option, C, which is 99222, which is an inpatient hospital, initial hospital inpatient observation care codes. So once again, what we are looking is for an inpatient consultation codes. Option C is also incorrect. And option B, 99244, that is for an office or other outpatient consultation. Well, since the patient was admitted to the hospital, this is an inpatient consultation and not an office or outpatient consultation. So that means option B is also incorrect. That leaves us with option A, 99254, which is an inpatient or observation consultation for new or established visit patient which requires medically appropriate history, examination, and moderate level medical decision making. So 99254 is the correct answer. So let's just cross check and let's just do an let's just do an leveling using the PDA chart. And inventory, we're having diabetes mellitus with hyperglycemia and acute appendicitis. So that would be a moderate problem where we have one or more exacerbation of one or more chronic illness. Yes. And how about the procedures? Data reviewed coders. What would be a data in the scenario? We have an HbA1c and RBS. Yes, that would be a low level data. It's just 2 points in category 2. And risk, we have insulin which has been added to the prescription chart, medication chart. That would be a moderate level risk. And the ENM level is going to be 99254 of inpatient consultation. Yes. Okay. So how are you feeling, coders, on this one? Please let me know in the chat if the explanation helps or you need more explanation on this one. Yes, okay, good to know. So we are moving on to scenario number 8. Are you ready, coders? Are you ready for scenario 8? Yes, getting better all the time. So practice, 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 and you will get there. I can see you all improved when I saw from what I saw in week 1. You all have improved in confidence and you all are picking correct answers as well. So let's move on to scenario number 8. And I think it's Miss Karen who's coming up to read scenario 8 for us.
Good night, coders, and we are almost there. 1 99469 2 99479 3 99472 and 4 99478. Dr. Adams, a neurologist, provided daily management and monitoring, including ventilator support, total parenteral nutrition, and other necessary inventions for premature baby Noah, born at 26 weeks of gestation. On the day followed of admission to the neonatal intensive care unit due to respiratory distress and with a present body weight of 1,750 grams. Sorry for that. I live in New York. What CPT code should be used for Dr. Adams' inpatient neonatal intensive care service for Noah? You have 2 minutes.
So thank you, Miss Karen, for reading scenario 8 for us. And from what I see in the chat, I think everyone got this one correct. Aha, yes, I had to change the options from option A to D, from A to D to 1 to 4 for this one is fabulous. Yes, exactly. Awesome, awesome work, coders. Yes. Okay, so let's solve this scenario together. Dr. Adams, neonatologist, Noah born at 26 week of gestation, premature baby, on the day following of admission, neonatal intensive care unit, present body weight 1,750 grams, and neonatal intensive care service for Noha is what we are looking for. So we are coding for Dr. Adams inpatient neonatal intensive care services for Noha. And it is for on the day following the admission. Yeah, that means it's for a subsequent day which we are billing or which we are coding here. So that will eliminate option 1, which is 99469, subsequent inpatient neonatal critical care per day evaluation and management of critically ill neonate 28 days of age or younger. Can someone explain why I can eliminate option 1, coders? Why is option 1 wrong? Yes, you all have got this one correct. Why is option 1 incorrect? Let me know in the chat, team. Exactly. Exactly. This is because option 199469 is coding for critical care service codes. And what are we looking here at? We are looking at Dr. Adams inpatient neonatal intensive care services. And neonatal intensive care services are different from critical care service provider. Exactly, yes. And I can eliminate option C as well, which is 99472. Why, coders? Because of same reason. This is also coding for a critical care service. And what we are coding for exactly NIC. We are coding for a inpatient neonatal intensive care unit service. So option 1 and option 3 is incorrect, and option 4 also is wrong, which is 9947A, that is for subsequent intensive care per day for the evaluation and management of recovering very low birth weight infant present body weight less than 1500 gram. So it is for a patient, it is for, yes, it is for a neonate or a patient who's less than, yes, a neonate less than 1500 grams. And in our scenario, the baby was having a body weight of 1750 gram. That means option D is incorrect, and we have to code for the exact correct CPT code. That would be 99479, which is for a subsequent intensive care service per day for evaluation and management of a recovering low birth weight infant. Yes, low birth weight infant. Present body weight is of 1500 to 2500 grams. The correct answer is option 2. Yes, there you go. Wonderful. I can see you all even giving the answers, reasons why I picked option 2 in the chat. Exactly. It's for infant scenario, weight more than 1500 gram. So how are you doing on this one, Coder? Shall we move on to the next scenario? Did the explanation help? Shall we move to the next scenario? Scenario number 9. Okay, so the next one would be the last scenario for our week 4 E&M study session. So are you all ready to knock it out of the park. Yes, I am sure you all are going to do great on this one. So once again, Miss Karen is going to come to the stage, come to the floor, and read the final scenario of the group study session week 4 for us. Miss Karen, please and thank you.
Okay, guys, let's finish strong. A 99291, B 99477, C 99468, and D 99471. A 1-year-old child, Mary, admitted to the critical care unit at the pediatric hospital with severe sepsis and respiratory failure. Dr. Miller, a pediatric critical care specialist, provided initial critical care service and placed child on mechanical ventilation. What CPT code should be used for Dr. Miller critical care service? Let's get it. 2 minutes.
And that is time. I've already highlighted the keywords here. My on clicks were off. So we have a 1-year-old child admitted to critical care unit, severe sepsis, respiratory failure, initial critical care service, patient placed in mechanical ventilator. So before I'm moving on, let me thank Miss Karen for reading scenario number 8 and 9 for us. So now let's solve this case. For this, we are having, yes, these are our code options. We are coding for Dr. Miller's critical care services. Yes. So 99477 option B is incorrect. Can you tell me why, coders? 99477. Yes. Now that is for an intensive NICU services. Yes, that's for an intensive neonate services. Yes, and also that is for a intensive care service given for a neonate age 28 or days or 28 days of age or younger. Yes, so option B is incorrect. And option C, 99468, is coding for initial neonate critical care per day. So why is option C wrong, coders? Let me know in the chat. Why is option C also incorrect? Once again, yes, that is also coding for neonatal critical care service code for a neonate 28 days of age or younger, exactly. And option D, it's between option A and option D. So we are having inpatient neonatal or pediatric care guidelines here, which states that the code 99471 to 99476 may be used to report the services of directing an inpatient care of a critically ill infant or young child from age 29 days of postnatal age through 5 years. And in our scenario, the age of the patient is 1-year-old patient child. So that means the codes must be selected from the series ranging from 99471 to 99476. It also states that the service for critically ill or critically injured child of 6 years of age or older would be reported with the time-based critical care codes of 99291 and 99292. So it's not the time has been not documented in the scenario as well. So from the guideline, I can eliminate option, yes, I can eliminate option A 99291, and that would leave us with option D 99471, which is an initial inpatient pediatric critical care per day evaluation and management of a critically ill infant or young child of age 29 days to 24 months of age. That means our patient's age falls between 29 days through 24 month of age, that is 2 years. So we have a 1-year-old child in the scenario, and the correct answer is going to be option D, which is 99471. So how are you feeling, coders, on the last scenario? Was it good? It's better. Feeling good, yes. Yes, I can see good response. Good response in the chat. So the correct answer is going to be option D, 99471. So with that, we wrap up our 4-week long study sessions on evaluation and management. So on behalf of the entire AMCI and my intern, my team, I would like you to thank you. So please don't forget to leave us a feedback after the class on how are you feeling. How was the E&M study session for you all? Did that improve you all overall on E&M coding? Did that help you? So let us know in the feedback, coders. And so as I said, once again, on behalf of AMCI, I would like to thank you for being there for the E&M study sessions. Yes, and you all are fantastic. So keep up the great work, and you all are doing a good work here. And I would like to wish you all the best for your upcoming exams if you already planned the exam. So I can proudly say you all are AMCI prepared. So thank you, coders. Thank you, team, and all the best. See you around. Take care and bye.
Thanks for tuning in, and until next time, happy coding!